What are antibiotics? Antibiotics are a group of drugs which come under antimicrobial. So antimicrobial means anything which kills the microbe. So antimicrobial antibiotics are a class of drugs which target bacterial infections. What are they not used to treat? They're not used to treat sore throats, they're not used to treat food poisonings, they're not used to treat viral infections. Only a doctor, not a chemist, not a family member. A doctor will assess your situation, will assess your symptoms, and then he or she will prescribe an antibiotic based on the need, based on the symptom. They will study what bacteria is most likely to cause your symptom, and then they will prescribe an antibiotic. If you turn the strip that your antibiotic comes in, there will be a box marked as Schedule H. So Schedule H means that it's a prescription only medicine. What happens is that number one, people don't take the entire course of the antibiotic. Number two, people take antibiotics when it is not necessary at all. Number three, people end up taking antibiotics which have no relation to their symptoms at all. So what happens because of this? Side effects can they end up with? Diarrhea. Number two, allergy, which is more severe. What it is going to cause, a very major global health concern, is called antimicrobial resistance. So antimicrobial resistance is basically the bacteria, because you're taking the wrong antibiotic or because you're taking not enough antibiotics, what happens is that the bacteria actually become resistant to the antibiotics. What is the most common antibiotic which is prescribed, which is taken from the chemist, which is given by family members? Azithromycin. It is actually a watch and wait kind of an antibiotic. You should not be giving it to anyone and everyone that you see. You should not be giving it to children. What I'm basically trying to say is that you need a doctor to assess your symptoms first, and then and only if they prescribe do you go for an antibiotic. One. Second thing is that how much do you need to take it? The doctor will assess your symptoms and he or she will let you know how many days you have to take it for, and you have to take it for that many days. That is when the infection is going to go, number one. That is when the bacteria will not become resistant, number two.